LJ, Lori. Good. Welcome to True Health Tuesdays. Tonight we're talking about oxidation and inflammation, which if you're listening to the medical world, and I actually have the medical world has a representation here of our doctor, okay? Because if you think inflammation's bad, you absolutely don't understand how human beings are. So we have to get the medical perspective because what's being done just isn't logical. Now when we look at this, there's a couple of terms we got to know. One of them, and this is stuff that you hear every time you go to like Whole Foods or some kind of health food store. Everybody talks about pH level, okay, and they talk about these terms, but we got to break it down. So pH is the level of acid to base. That's all it is. It's how an item gives up a hydrogen. Now oxidation, that's like rust. So it's like if you take an apple, slice it, and the apple starts to discolor. Well, oxidative metabolism is also stuff that goes on in our body. Metabolism, that's the buildup and breakdown of tissue. This is something that you need or you die. And I should have brought in some of the osteoporosis ones, but figure you got cells that live on the bone called osteoblasts, they lay it down, cells called osteoclasts that tear it up, and you need that for healthy bones. Somebody came up with a drug called biphosphate that actually stops that process. So guess what? The bones appear thicker. I know, they break easier, but they look better on a test. Okay, and catabolism is breaking down, anabolism build them up, phytonutrients, and it's kind of neat because this is in plants, and plants have been exposed to viruses, funguses, bacteria, cancer, and they've developed certain properties that help them survive. So what's neat with us, think of phytonutrients. No? Okay. Well, it works for me. Okay, but they help fight stuff. Okay, so if you take it in your system, it's good for you. And so you're going to see this scale. And what a lot of doctors will say is, and this is typical in the medical world, that pH, your body regulates it, and the human blood is between 7.35 and 7.45. So that's a very narrow range. If you go above or below, even we're talking 0.2 of a point, it's called dead. Okay, so your blood pH is very, very narrow. But what the body does to maintain that blood pH is vital. And sure enough, I mean, look at this. A lot of people will talk about how it doesn't matter what you eat, whether you eat animal products or vegetable products, it doesn't matter. Everything's going to come out at an acid level about 3.5 pH. And that's true. However, you got this organ here at the base of it called the pancreas, and this pancreas secretes out a tremendous amount of bicarb to alkalinize that system, because you can't have that stomach acid. I mean, you could have stomach acid that you could pour on a wooden floor and it'll burn a hole right through the wood. You could put a nail in there, it'll burn right through that. I mean, this is really powerful stuff. And so if that hits the intestinal tract, it can damage the intestinal tract. So you got this organ system right there that instantly alkalinizes it. I mean, it's brilliant. So this also means that if you have a system where you're requiring more and more pancreatic function, that pancreas is going to start to wear out. It's not going to be available for its other actions. Because that pancreas is designed to alkalize the system. It's also designed to digest. It also helps design to regulate blood sugar. So it's got a lot of functions. So the pancreas just flat out has to work harder, and it wears out. Now, this is what I want you to understand. Acute inflammation is how the body regenerates tissue. And it's a brilliant symphony that most doctors, I'm sure they don't understand, because none of it makes sense. I mean, the way the doctors utilize medications is beyond crazy. So once you break a cell, could be a splinter. Has anyone in here ever been cut? Oh, you have? Oh, God, it's almost, I guess everyone in here has. So did you ever have to say, no, don't talk to me, I got to heal this? No, you don't have to concentrate on it. It happens automatic. And this is the brilliance. Once you break a cell, histamines are released. Okay, and what those histamines do, you've got little tiny blood vessels in there that carry the red blood cells, and they're called capillaries. They're very, very small. Once the histamines are released, it increases the permeability of the capillaries. So the capillaries start leaking. So it gets more fluid and platelets inside of that damaged tissue area. Also, once the histamines are released, it draws phagocytes. And phagocytes are these big, to phage means to eat. So you got these big eaters. Do you know how to say big eater in Latin? Macrophage. I know. I got two doctors here, and they remember. Oh, yeah, we remember cellular biology. Okay, yeah, so those macrophages, they eat up any bacteria, any dead tissue. Because, have you ever gotten a bruise? You're breaking blood vessels. That puts blood in an abnormal area that stimulates macrophage activity. So the macrophages, get this. I mean, you got to walk by a mirror and smile. Those macrophages chew up those abnormally placed proteins. It puts it in the lymph system so it gets recycled back down through so nothing's wasted, so the liver can actually reutilize the proteins. I mean, it's just brilliant. And so you get these platelets that are inside of the capillaries that migrate out and start to form healing. But also, when we look at this, there's certain aspects of this, because that's wound healing on local inflammatory response. And that's the same thing we do in a corrective chiropractic. We're going to cause inflammation at the level of the disc. But what other things can cause cell damage? I mean, here we got a piece of wood or a splinter causing cell damage. What other things can cause cell damage? Well, drugs, diet, vaccinations, natural aging, stress. And it creates what's called free radical formation, or it can. And what that is, y'all remember when, you're talking about a stable atom. Okay, how like a carbon has like 4 points on it. We're talking oxygen has a couple coming around it. And if any of them, there's always neutrons and protons on the outside edge. If one of those breaks off, an electron, then it needs to attach to something. And that means it's a free radical. So any atom that's missing an electron, it has an affinity to attach on something else. And if it does, it's going to steal that. So it's like a chain reaction where one free radical can start damaging other healthy atoms, and then that can eventually cause cellular damage. Well, antioxidants have a tremendous amount they can give up electrons, so they can take care of free radicals. So if you have damage from drugs or environmental toxins or, just modern, radiation that we're exposed to, if you take antioxidants, it nullifies, it takes out those free radicals, which is hugely important. Now, when we look at oxidative stress or free radicals, because those two things, your body's able to handle at a certain level. If you reach the threshold where you can't recover from this tissue damage, that's when you start developing disease. That's when it's beyond. But then you start looking at this and you say, wait a second, free radical damage in the eye, that's macular degeneration, cataracts? What about free radical degeneration in the heart? So that's hypertension, high blood pressure, myocardial infarction or heart attacks. And you start saying, wait a second, does this mean virtually every disease has to do with inflammation or oxidative stress? It does. I'm sorry. Virtually every disease has to do with oxidative stress or free radical formation. Wow. Thank you. Oh, God, I had to work so hard for that. Okay, but what's neat is, too, it's not like some demon out there, okay? It all has to do with our body's ability to heal. So this means that every disease can be handled if we understand this inflammatory process and work with it. Isn't that cool? I know, I think it's really, really cool. Plus, we're looking at Alzheimer's, Parkinson's, lupus, irritable bowel syndrome, asthma, rheumatoid arthritis. All of these are oxidative stress. It's everything. Now, we can call it pH balancing mechanisms, but it's really how your body regulates it. I mean, respiration, perspiration, poop, peep. Okay, but then you also need minerals, you need vitamins, you need supplements in order to help regulate that pH balance. In fact, I'm feeling a little acidic. I got two choices. I can have diarrhea or breathe. Which should I do?
Breathe.
Breathe, okay. See the carbon dioxide go? That's an acid. So when somebody says, and I'm going to bring up a case in a bit, who's got massive free radical damage. I mean, it's frustrating. And this is, again, huge. You know, they teach a lot of Latin names, and tumor, rubor, dolor, calor. That means just the swelling, the heat, the pain, the redness. Those are all the 4 stages of inflammation, and this is what all doctors learn. But they don't appreciate it. They really don't. Otherwise, they wouldn't be prescribing an anti-inflammatory. And there is one, and this has to do with threshold of events, because everybody can survive 1 cut, maybe 100 cuts. In the ancient world, they had the death of 1,000 cuts. I know, bad. Okay, no lemon juice, you know, just 1 slice of paper and a mean guy. Okay, but when you go in there, you can heal some, but eventually the histamines are too much to be released. It exceeds your body's threshold. And this is why people die. This is why you've got this mindset of inflammation. This is why the medical world thinks that inflammation's bad. It's not. It's a repair process. But what we're seeing here is that a lot of the people are suffering. No, quiet. I'm going to talk to you later. A lot of people are suffering from chronic inflammation, and the solution is just insane. So when we look at I mean, these are diseases of oxidative stress, of chronic inflammation, of the lack of the body's ability to heal. And we're looking at Alzheimer's, Parkinson's, heart disease, cancer, strokes, chronic fatigue. I mean, it's the list of inflammatory diseases is tremendous. So what this means is, when I say inflammation, it's a body's healing process. It's the body trying to heal. So it means that there's tissue damage. So if you're doing any therapy to solve these diseases and it's not healing tissue, it's ineffective and will kill you. Okay? It's that important that if you understand this process, you live. This is pretty much everything. If your body repairs faster than it breaks down, you have health. If your body breaks down faster than it repairs, you have a dis-ease. Okay? And that's it. But we go through, and I hate to say it because I want to show this again, you know, you start looking at this and people have the mindset that asthma, depression, cancer, aging, strokes, that these are diseases that actually exist. Instead, they're not. It's just the body has tissue damage. Some ignorant people are trying to treat the tissue damage instead of take care of the inflammatory response and allow the body to heal. Okay, and that's how I mean, this one here out of the Journal of Rheumatology International. Fibromyalgia, supposed to be an incurable disease, even though I wrote the book, How to Cure Fibromyalgia. Okay? You know, and multiple doctors have written the books on how to cure it because it's not incurable. And this even says it's an oxidative stress disorder. So if it is an oxidative stress disorder, does that mean that the body's trying to heal? Yes or yes?
Yeah.
It is. So if it's trying to heal, all we got to do is any therapy we do has to be in conjunction with that healing. So if they have muscle pain or inflammation or some type of tissue, should we help that inflammation or give an anti-inflammatory? Help it. I know. It seems like basic, but any therapy that works with the body. Now we're also, and I'm going to talk about this in a couple of weeks, on the geoengineering, okay, or it's solar radiation management. It's the chemtrails. When you look outside and you see these big old long stringy things in the air, and you think, well, those are contrails. They're not contrails. They're actually, it's a chemical solution of the planet to global warming. And see, it's too expensive to stop burning fossil fuels. So what they're doing is they're trying to shut down or treat the planet. Since the planet's sick, they're trying to chemically alter the sunlight to go into the world, and it's worked. Okay, it's decreased sunlight by about 25%, which is kind of nice. However, you decrease sunlight, you also disrupt the harmony of the planet. That's okay. I was probably responsible for it. Yeah. To the miracle of modern editing, Dr. DeWitt will take care of that. Chemtrails, take two. Okay, so we're talking about an inflammatory response as a healing response to the body. What's interesting, when you go outside and you see these big old huge white lines, that's a response, again, from the people in authority to try and fix a problem. The problem is the planet is warming up. We're losing our ice caps. We're losing about a little bit over a mile of Greenland ice sheet a year. And the parts of the planet that are keeping our system temperate and warm and healthy are dying. Okay, so they're putting these particles in the atmosphere of aluminum, barium, titanate, and strontium, and we're breathing it in, and it's causing an inflammatory response in our body. Now, I'm going to cover this in detail in the second weekend in June, where we're going to explain why they're doing this, what's the problem, what's going to happen. But luckily, even if a body is poisoned by blood pressure medications and cholesterol medications and metformin and antacids and you know, pain relievers and I mean all of that stuff, the body can still survive if we stop poisoning it. Okay, the planet's going to survive. We just got to stop poisoning it. So knowing that this, and it's interesting because we are breathing in this, look at the similar damage from breathing in these barium titanate particles. Parkinson's, Alzheimer's, bronchitis, cancer, atherosclerosis, hardening the arteries, high blood pressure. Can you see a similar effect, okay, on the body? Because this is also causing an inflammatory response. The reason is those particles that are designed to shield our planet from sunlight, and they are, it's decreased 25%, but it's also decreasing the evaporation so we don't get the cloud formation. So we're getting a huge amount, okay, of dry spells. Okay, now that's okay because what's the planet going to do? It's going to dry out the plants. There's going to be more forest fires, which is going to put more carbon in the atmosphere, which is going to cause the cycle to get corrected. But we're going to go over the details of that. Just know that when you see the lines in the sky, it's causing an inflammatory response in your body. So when we look at this, inflammation and scarring of the lung tissue. Yeah, well, I mean, you know, it's just as changing the global climate is just as intelligent as drugging a human being, okay, for symptoms. Okay, I know I'm making fun of you. Okay, so how could you not? Okay, I mean, this is, if we understood this, that the body, its health is the natural state. Your blood's only 120 days old. Your bones are about a year and a half old. And when we look at this, I mean, you could take a piece of the colon, cut a section out, sew the two ends together. I don't know why you'd cut a section out, but some people do. Okay, but 24 hours later, you can't see the joint on the inside. The lining repairs that quickly. 1 billion cells a day you build. And this is no matter what. If you're in a healthy metabolic state, you're building 1 billion healthy cells. If you're building 1 billion cells a day and you're using Kmart parts, you're going to get a Kmart body. Does that make sense? I know. It doesn't make any sense at all. Now all cells, just like your body, they have to do a couple of things. They have to take in nutrients, eliminate waste products, and produce proteins. That's every cell. Every cell has to do this. They have to complete this cycle in order to survive. So health, and this is a shocker, is optimal cell function. What this means is health is not blood pressure of 120 over 80. Health is not one consistent physiologic vital statistic. That's foolishness. Okay, if you're in a stress state, you need higher blood pressure. If you drop a brick on your foot, I would hope it would hurt. Okay, it doesn't mean pain-free. If you drop a brick on your foot, what happens to the heart rate? It raises. So that's an inflammatory response, raising the heart rate in order to heal the tissue. Does that make sense? Okay, so what if you had systemic inflammatory response where you're damaging your lung tissue, knowing that carbon dioxide is vital in order to balance your pH? Do you think that your physiology or inflammatory response will have to increase if you're just breathing the air in freaking America? Yeah, it has to. So it's not one vital sign. It's not one number for everybody. That's foolishness. Lack of health is lack of optimal cell function. And this is when we get into the medications, because medications alter physiology. They alter physiology, how your body's adapting. It's kind of like drugging the planet. That's what the chemtrails are. Well, this is drugging the body. I mean, this was from 1999 to 2008. This is the number of drugs. Now, when you look at this, do they ever study more than one drug at a time? Rarely, if ever. I mean, I've seen some studies that do one or two drugs no more than a couple of months, a couple of years, but nobody's, and here when we're looking at it, 10% of the population, this is the United States, 10%. Okay, last time I checked, it's about 360 million, okay, are taking 5 or more drugs in 2008. Now, that was 6 years ago. Do you think the population's like woken up and just said, my God, this is stupid, taking 5 or more drugs? Or do you think it's worse? It's worse. I'm sorry, what's a commercial say at the end of it after they've told you that it causes rectal bleeding and suicide and death? Ask your doctor if this is right for you. How does he know? He doesn't. This is the most intelligent response you can get. Because, I mean, when you're looking at this, I mean, we're talking 48%, and this is in 2008, are using more than one drugs. Okay, now those drugs, what do? Do they slow or stop a metabolic process? Yep, they sure do. Okay, you know, and you start looking at this and you go, do you ever check more than, you know, no. This is insane. This is why I'm using this caricature. Because when a medical doctor comes here, they're bound to their certain protocols. He should have chains on his hands because he can't do anything other than their protocols. And that's foolishness. That doesn't make any sense. And look at this. Drug-induced deaths. Now, this is the right drug at the right time for the right diagnosis. This isn't heroin and cocaine. These are prescription drugs that your doctor gives you. Okay? But you're actually, you know, we've got a mindset. One of the things, and this is when I was doing a talk on AIDS in Africa, they're not dying according to schedule. Do you know why the Africans aren't dying according to the schedule?
They're not taking drugs?
No. If they take a drug and they feel bad, they stop taking it. I'm sorry, what's that called? Laura, my mom gave it to you and to me.
Common sense.
Common sense. Okay, good, just checking. Okay, in America, no. You got white coat syndrome. This God in the white coat told me to take it, even though I've got explosive diarrhea, I got no energy, I'm feeling upset, I'm moody, I'm fluctuated, my blood pressure's perfect. Can you see that? It's insane. More than gunshot deaths, homicides, suicides, and well, recently, I'm sorry, those are, this is 2007 statistics. We actually, drug deaths passed motor vehicle accidents. This was a USA study showing that, and this I love, 25% of the people surveyed in this were taking between 10 and 19 prescriptions. Okay, yeah, so we have to wake up. You have to break the hold of the white jacket, because that's not working. I mean, this gal, just sweet like you can't believe. I adore her. I changed the name. 5 blood pressure medications, couple of antidepressants. That's her side view looking. And you can see there's just degeneration right there. We bent the neck. The joint's open. She's going to have 100% recovery. 100% guaranteed. And what's frustrating, though, usually within about 2 weeks we can show how to take blood pressure and it starts to normalize. Guess what most people say? Well, I got to ask my doctor. And I said, no, your doctor's working for you. If you're healthy and you're feeling good, that doctor's doing a good job. If you're taking multiple medications and you feel like, okay, good. If you're not feeling good, okay, he's not doing a good job. Fire him. I mean, the old days, you would pay the doctor when you felt good. If you felt bad, you'd stop paying him because obviously that guy is not doing a good job. I'm going back to that. Okay, I've got to guarantee results. I've got to change x-rays. I guarantee that your blood pressure will normalize in about 2 weeks. You just got to follow my freaking advice. Okay? Good. Yeah, she's going to get better. But you can't get better eating this stuff. This is inflammatory materials. If you take genetically modified stuff, it's going to damage the stomach lining. If some of this stuff can get into the bloodstream, good God, it's going to inflame your arteries because you're damaging the tissue, and the body's going to release a tremendous amount of histamines in order to repair the damaged tissue that you're doing. But then when you see this, how many people are getting, the giant liter and a half of Coca-Cola because it's only 45 cents or 99 cents, and they're feeding the genetically modified stuff to their kids because it keeps them happy. No, we got to change this. Get them into lemon water. Get just regular old water and squeeze a lemon in it. I mean, it's going to be good for them. It's going to alkalinize the system. And so when the people say, well, no, it doesn't matter what you eat. It comes out at the same pH. They're absolutely right. Animal products or plant products. However, if you eat the animal products more, or acidic materials, or the fast food, the residue is what's toxic. So after it goes through digestion, so you get this toxic residue in your intestinal tract, that's what causes the damage to the mucous membranes. That's what causes the damage. Whereas plant products, your residue it's alkaline. It's actually healthy and good for you. So you got to have a plant-based diet. This stuff has to be avoided at all costs. The omega-3 to 6 ratio. It should be a 1 omega-3 to 1 omega-6. Sometimes 3 to 1 ratio will work. But you can't have it because disease starts at an 8 to 1 ratio. And when you start feeding herbivores like cows, meat products, we're feeding them ground up cows. What's that called? Cannibalism. Oh, thanks. Yeah, I know. That's gross. Okay, yeah, so that wouldn't work. Okay, you get an unhealthy animal. But that's okay. You feed them enough antibiotics, you can keep alive long enough to slaughter them. Okay, so the American diet is 20 to 1. If you look at those beautiful clear bottles of oil, the corn oil and the canola oil and everything, that's poisonous stuff. Oil shouldn't be clear. Okay, you can't use that stuff. So the soybean, sunflower, cottonseed, grapeseed, all of those things, the clear oils. And you could say, well, grapeseed oil, isn't that healthy? Yeah, it's a high heat oil, it's okay, but it's still too high an omega-6 ratio. Okay, you need to have healthy saturated fats. You've got to stay away from it. Because if you've got polyunsaturated fats in your diet, if you've got a high omega-6 ratio, it is slowly killing you. Okay, we can't have that stuff in our diet. And I love this. Chronic disease. In the Journal of the American Medical Association, they're saying that if you supplement, if you give a healthy nutrient, okay, if you don't supplement, and this is the Journal of the American Medical Association and British Medical Journal, if you don't supplement, you're guaranteed to get a chronic degenerative condition of heart disease, cancer, diabetes, and arthritis. Are the doctors today reimbursed, paid for, can they bill for giving you advice on nutrition, on supplements, or do they only get paid by writing a prescription? And if they're on staff of a hospital, they have to justify their position on the hospital by prescribing. And it's true and it's wrong. These guys, if you utilize medical care for health, I truly don't recommend it. because it's obviously the leading killer in America. But if you use current medical care for health, fire the doctor if you're not feeling good. Okay, that's going to change the system. That's the only way to change it, is if they're not doing their job, fire them. If I'm not changing the shape of a spine or correcting the nervous system, fire me. Find somebody who's better. I don't know any, but, you know. But I study all the time. There's actually one guy in Texas that's better than me, I think, and one guy in Oxnard that's better. Dr. Shanahan in Texas. The guy is just, oh my God. I think he could walk across the swimming pool. He's incredible. Same as me. Corrective chiropractor. Yeah, he's just better. Taller, better looking. Okay, but now here, when you look at this, I mean, pesticide exposure in infant food. Okay, so when you say I can't afford organic for my kids, yes, you can. You can't afford not to. It's called neurologic damage. Genetically modified. Again, accelerated aging, and all of this stuff. Cholesterol synthesis. This is all inflammatory response. I mean, in Europe, in Mexico, they're educating the population to where you can't eat this stuff because it causes systemic inflammation and damages tissue. University of Irvine, just over here a few blocks. Children who eat as few as 3 hot dogs a week had 10 to 12 times. 10 to 12 times. That's not 10 to 12%. That's 10 to 12 times higher rates of leukemia and brain tumors. I mean, we should be storming Albertsons and saying, get that crap off the shelves. And that's an appropriate term. C-R-A-P. Okay? See, I got a filthy mouth sometimes. Okay. And this one, aspirin a day. Leading cause of kidney disease. People are taking it like a vitamin. Okay, and this was the most definitive study on aspirin that just came out last year. And yes, you take it. You have a 10 to 15% drop in a certain age group of coronary artery disease. Now, they're just testing aspirin. You have, which means there's 30 to 46 deaths per 100,000. So 30 to 46 people have less chance of a heart attack. However, 60 to 117 have gastrointestinal bleeding severe enough to go to a hospital. 8 to 10 have a hemorrhagic stroke. Now, is there anything healthier that you could do that could protect your heart? Okay, similar? Yeah, serving of fresh fruits and vegetables a day. It has a better protective effect than prescribing a toxic chemical that damages or slows down an inflammatory response. I mean, and I love this. This is a professor at Warwick Medical School. Clear that there's an incredibly fine balance between the possible benefits and risk of the intervention. We need to be extremely careful about over-promoting aspirin intervention without having first fully understood these negative side effects. Negative side effects? You don't know how the thing works in the first place. Intervention. Why are you intervening in a process that you don't understand it? Why are they doing chemtrails when they don't understand the process, how it's going to cause drought in one area and decrease thermohaline currents in the rest? I mean, it's insane. You can't give an aspirin that's going to cause bleeding and weaken blood vessels and expect to have a positive outcome because it might cause blood cells to not clump together. Do you know that the thing that clumps blood cells together, those little red blood cells, it's polyunsaturated fats? Okay, it's inappropriate protein digestion. Maybe it's too many soy products. Okay, and you start looking at this. Too much canola oil will clump the blood cells together. So you start looking at this. Look at the cause of why. You don't want to do an intervention that's toxic. Tylenol and nonsteroidal anti-inflammatories cause decrease. Okay, I mean, and you look at this. You look at this and you say, wait a second. The American Journal of Medicine says that the Tylenol, what drug do you prescribe for joint pain? Non-steroidal anti-inflammatory or Tylenol. Do you realize that it destroys joint cartilage? That's our protocol. Wait, I'm sorry, sir. Do you realize the full physiologic effect of what you're doing on that human body? That you're prescribing the deadliest drug in America, Tylenol, for joint pain? Yeah, it's our protocol. Ask your doctor if it's right for you. Anybody want to ask him? Okay, yeah, because we got to put him on the spot, because this doesn't make sense. It's ridiculous. This one here, diabetes type 2, British Medical Journal. If you realize that diabetes type 2, that's 95% of all diabetics, you're talking within about 4 to 5 days, their blood sugar is normalized without drugs. By eliminating animal products, going all raw, getting the nervous system healthy. It's usually 4 to 7 days, okay, on the average. Dr. Gabriel Cousens wrote the book, okay, Cure for Diabetes, and there's a video raw for 30 days. I recommend it. But I mean, so there's a curable condition. It's curable. Not treatable, curable. If you take a drug to lower it, you lower blood glucose 9%, it increases death, that's mortality, by 19%. So the drug you take will lower blood glucose, it just kills you earlier. Okay, if you lower blood glucose 14%, again, death increases 43%. So that doesn't make sense. Okay, it doesn't make sense at all. This patient here, and this is brilliant, 65-year-old gal. In my world, that's young. This is her standing up straight before. Now, she was taking 6 blood pressure medications, high blood pressure, cholesterol, or 6 medications, and we're talking just the gamut of everything that she's on. And this is a 13-degree, a 9-degree, and a 5-degree bend. 13-degree bends down to 6, the 9-degree bends down to 6, and the 5-degree bend's gone. Okay, that's in 90 days. But what we're doing, we're taking a spine like this and we're realigning it. Does that change proprioception or brain function? Yeah, absolutely. Do we take them out of a stress state? So what happens to heart rate in a stress state? It goes down. It does. And so this is the craziness. So this is her body under stress. In a normal stress response, do they need higher blood pressure than a person that's not in stress?
Yeah.
Yes, they do. They do. So to compare these two people, 9 months or 90 days earlier in post, she required higher blood pressure for health. She required higher cholesterol because that's what you use as an anti-inflammatory called cortisol. She required a different physiology than this. You can't chemically alter. You can't intervene, okay, using a toxic chemical and expect a positive outcome. Does that make sense? Okay, good. This is good for you if it's organic and it's not genetically modified. It's actually how your body regenerates itself. And this is what you require. You really do. You require a subluxation-free environment. You need healthy nerve supply. That controls and coordinates everything. Exercise. It's fun to look buff for your sweetheart. Don't drool, dear. Okay, but it's for movement of lymph tissue. Okay, proper nutrition. This means that man makes it. You don't eat it. Sufficient rest and prayer and meditation. It's vital for healthy cell function. You need this. You really do. Now, all of these, the videos, the PowerPoints, everything's available on our website. So please, I encourage everybody on YouTube, everybody to go to our website, spread this information, because we got to stop this ignorance. This kind of stuff is killing people. Okay, it's killing people. And this is the most respectful puppet that I could come up with. Yeah, you can tell if you're in the job of helping people, I don't think that prying toxic chemicals is appropriate. That's not it. So now, next week, we are talking about the thoracic spine, hunchback, scoliosis, and also the off button on how stress can kill. So thank you very much.